Welcome back to my channel. If you are new here, I'm Chris, and I'm a medical doctor and a PhD candidate in epidemiology. And I'm also helping the healthcare professionals to relocate to another countries. Today in this video, I will explain the important tips when you want to apply the RMO positions in Western Australia's recruitment. And this video I focus RMO positions only. If you want to apply another positions, you need to know thoroughly the whole process, because Service Medical Registrar recruitment is a little bit different from RMO positions. So today I will focus only on RMO positions. So let's get started. This recruitment start from May 26th to June 23rd. So you have to aware of the closing date, otherwise you will miss the applications. So let's start with RMO salary. RMO salary start from Australia dollar 117,000 to 139,000 Australia dollars. Is quite attractive, right? And you can also have a benefits of inclusive superannuations 12%. This is effective from July 1st 2025, so it's mean that it will start this recruitment process. And you will have a benefits of the professional development allowance as per Western Australia healthcare systems. So they provide key documents for this process. So you must thoroughly read these all documents if you want to maximize your chances to get higher. If you didn't understand the whole process and the required documents, you will miss this opportunity, because Western Australia is IMG friendly state, and they recruit IMG higher than other states. So this is the good opportunity, and you need to know that required documents and the process clearly and thoroughly. So they provide 5 key documents, but if you are applying in RMO positions, you don't need to read health service medical registrar job. If you are applying in health service medical registrar jobs, you don't need to read health RMO recruitment job descriptions, but some candidates can apply both positions. So for those candidates, you have to read all documents. So you want to know what are the benefits of Western Australia Health. So you can work in a large cities, or you want to work in rural and remote Western Australia. This is a good opportunities. And in this process, you can choose top 3 hospital sites as your preference across the Western Australias. And they provide competitive salaries and professionals development allowance. And you can have expert mentors, and you can work with them, and so you can expand your medical skills. These are the benefits when you choose the WA Health. And they already provide which health services are participating in this recruitment process. There are a lot of there are a lot of health services involved in this recruitment process, and I will count how many: 1, 2, 3, 4, 5, 6, 7, 8, 9. So 9 health services are involved in this recruitment process. Under the 9 health services, there are many hospitals under each health services. In this point, you need to understand which health services are recruit IMG, and which health services are recruit IMG with only AMG 1. Which services or which hospitals recruit or welcoming the IMG with AMG 1 and AMG 2. So this is the important point. You need to analyze which services you have to apply depends on your qualifications. If you have AMC 1 only, which services you have to apply, you need to know. If you already complete AMC 1 and 2, it doesn't matter, you can apply anywhere what you want. So AMC 1 only is limited, and you need to know where you can get more chances. And who can apply for this requirement? So you are eligible for registrations with Medical Board of Australia. It means that you must at least AMC 1 result, and you already cleared the English test. And so if you have both these results, AMC 1 and OET or IELTS, you are eligible for the APRA registration, so you can apply it. And another important point, I'm not quite sure you already know this information or not. They mentions you have at least 6 months of procedures and clinical experience as a registered medical practitioners in Australian hospital or comparable settings within the last 3 years. So they list the comparable settings in the attached applications guide. I will explain, or I will mention what they are comparable settings. So if you are not, if you don't have an experience in those comparable settings, you are not eligible. So this is the important point when you apply to the Western Australia. If you don't have the experience in working in those countries, they mention which countries are comparable with them. So if you are not working in those countries within 3 years, you are not eligible to apply. So this is important, and you need to aware of it. Okay, let's continue. So what are the documents you need to prepare? So they mention statement addressing the application selection criteria, and you need to submit a curriculum vitae or resume and cover letter, and Medical Board of Australia registrations, and your medical degrees, and your English language competency test result. And if you are, so you need to mention which pathway you want to apply. So if you are working in the United Kingdom with a pathway, you have at least 12 months experience, so you can go to the comparable pathway. If you have AMC 1 result, you can go standard pathway. So which pathway you want to apply, and you have to mention which pathway I'm applying for this recruitment process. So the application process is simple. You can click apply button in the below of the job description. So it is simple, and you have to prepare all the documents in your hand, and you can upload when you applied. So this is the first important tips you need to know when you apply this Western Australia recruitment campaign. And I will continue 2026 Western Australia Health Residence Medical Officer and Service Medical Registrars Centralised Recruitment Application Guide. So they already provide informative guidance, so you can read from beginnings to the end. They provide everything. So in this recruitment, they recruit a lot of positions in various places, for various places. So you don't need to apply multiple applications for the multiple positions and multiple hospitals. You need to submit only one applications, and you have to mention top 3 preference in your cover letter. So You don't need to apply multiple applications to multiple places. You need to apply only one applications with your preference locations, 3 preference locations. That 3 preference locations should align with your background, experience, and your qualifications. If you have only AMC 1, you need to apply IMG friendly place with AMC 1 result. These 3 applications, these 3 preference site is important because if doesn't match with your qualifications and experience, you will miss this opportunity, right? So please careful in this process. So I will repeat again, the applications opened yesterday, May 26, and it will close on 23rd June. So when they will reach out to your reference after closing this application. So if your referees are away from the workplace after their reference check, it will be traveled to you. So you need to remind them after June 23rd, they will reach out to your referees for reference check. So this is the important tips you need to aware of this process. So the notifications of outcomes will come on August 11. So it's almost 2 months you have to wait. So 2 months interval is quite quick in this recruitment campaign. The ordinary and traditional vacancy takes longer than the campaign recruitment. So campaign recruitment take a quick process. So I will explain in here which country they mentions the comparable setting with Australia's. In here I will explain which countries are comparable with Australia's. So minimum eligible criteria to be considered for an RMO or SMR positions, you must provide evidence you are eligible for registrations with Medical Board of Australia. So I already mentioned you must have at least AMG 1 and English test result. And you have demonstrated clinical and procedural experience for a minimum of 6 months as a registered medical practitioners in an Australia hospital or comparable hospital settings within the last 3 years. So what are the countries they list? Austria, Belgium, Canada, Czech Republic, Denmark, Finland, France, Germany, Greece, Iceland, India, Israel, Italy, Malaysia, New Zealand, Norway, Portugal, Republic of Ireland, Singapore, Spain, Sweden, Switzerland, the Netherlands, United Kingdom, United States of America. So you must have at least 6 months of experience in those countries. So these countries are comparable with the Australia settings. If you don't have experience in those countries, you are not eligible to apply. So this is the important point, and you might say that your applications you apply for many years in Western Australia's it's still silent. So this is the eligibility criteria because you didn't meet these criteria. So I don't know how can I suggest you to get this experience in those countries. So if you are working in the United Kingdom, you can apply easily to IMO campaign. If you are working in Singapore or Malaysia, this is the good point. You will have chances to get higher. And so this is the most important point in here. I already mentioned what are the required documents earlier. And you need to mention what pathway you are applying for this recruitment. Otherwise, if you are wrong way, this will miss you to get higher. And for the referees, you must provide at least 2 referees, and one referees, at least one must be recent your clinical supervisors within the past 12 months. So this is the important point. You need to provide one clinical supervisor. Recent job is better. So I already mentioned, but here I will say again, referees will be counted after the applications period has closed. So application will be closed on June 23rd. So after applications closings, they will reach out to your referee. So remind them to reply. So these all are the important tips you need to understand when you apply the Western Australia recruitment process. So these tips will help you and to get more chances to get higher in Western Australia. See you in my next video.